Hi, my name is Kiera Waters, and in this video, I am going to demonstrate how I would check a patient's blood sugar as well as administer insulin. So I don't have a patient with me, but the first thing I would do is I would knock on the patient's door, introduce myself. Hey, my name is Kiera. I'm the nurse that's going to be with you today, and I just come to check your blood sugar and give you some insulin as well. I'm going to check my orders, check my MAR. If you don't mind, can you state your name and date of birth for me? Okay. I do see I have the correct patient, as well as my order and my are there for the insulin as well as the blood sugar. So now what I'm going to do is I'm going to wash my hands. I'm going to dry them off. I'm going to put my gloves on. Miss Jan, if you don't mind, can you wash and dry your hands for me? Okay. My gloves are on. My patient has now washed and dried her hands. Miss Jan, I'm just going to prick the side of your finger and I'm going to check your blood sugar. So I don't have a patient with me, so I'm going to just demonstrate on my own finger. But what I would do is I'm going to prick the lateral side of her finger. I'm going to take an alcohol prep, open it, clean the site, allow that to dry, and then I'm going to take my meter. I'm going to insert, we'll turn it on, insert a strip, and then once the finger has dried, I'm going to take me a lancet. I'm going to prick the finger. Some blood is to the site. I'm going to take my alcohol prep, clean that off. I'm going to squeeze some more blood there. Some more blood. I'm going to take my meter. Allow that blood to get onto the strip. Okay, it's reading. Okay, Miss Jan, this is your blood sugar number. I will give her the number of her blood sugar. Looks like I am going to have to give you some insulin. I'm going to give her alcohol prep to clean her finger. Next, I am going to discard my script, turn off my machine, clean it, disinfect it really good, and then I am going to take off my gloves, wash my hands, as well as document into my patient chart what I've done. So once that is all done, my patient does need insulin. So I am going to check my patient's chart, check orders to make sure I have the correct order for insulin, as well as check it in the MAR. If you don't mind, can you state your name and date of birth for me? I have the correct patient. How have you been feeling today? You've been feeling lightheaded, dizzy, headache. It's been sweating, cool, clammy. Feel like increased thirst or eating or anything like that. You feel like your blood sugar may be high or low. Patient just told me how she's been felt. Okay, well, when was the last time you got insulin? Where was it given? Okay, patient has let me know that her last insulin was given her left arm, so today I'm going to demonstrate giving it to her right arm subcutaneously. So, do you feel like you're able to eat something? Okay. So what I'm going to do is I'm going to check my patient's site. Skin is intact and normal and able to administer some insulin. I'm going to wash my hands. I'm going to put on my gloves. Alright, I have my two insulins here, my regular as well as my intermediate. I have my needle. I'm going to check my my orders and see how much of the cloudy I have to draw, as well as how much the regular insulin I'm going to need. I'm going to check, make sure I have the right ones, as well as check the expiration date on both of these and make sure it has not expired. Next thing I'm going to do is I'm going to take caps off of both of those. Take me alcohol prep. I'm going to clean the site or clean the vial for 10 seconds. And then take me alcohol prep. Clean the side of the other one for 10 seconds. Allow those to dry. I'm going to take my insulin needle. Once I see how much of the cloudy I need, I'm going to draw that back. And I'm going to inject air first into my cloudy. Okay, get that. Then I'm going to check and draw the correct amount for I'm going to need for my regular. Making sure it's not touching. Inject the air. And now I'm going to draw up into my regular. The correct amount I need for regular insulin. Okay. I have drawn that up. Now I'm going to insert into my cloudy. I'm going to draw up the correct amount of insulin for this one. Okay. If I was outside the patient's room, I would label my syringe. Since I'm still in the patient's room, I'm going to go to my site. I'm going to take an alcohol prep, open it, clean the site in a circular motion, allow that to dry. I'm going to check my insulin one more time before I give it, make sure everything is correct. Next, with the bevel up, I'm going to pinch the skin. If it was 1 inch, I would use a 45-degree angle, and if it was 2 inches, I would use a 90-degree. In this case, I'm going to go at it with a 90-degree angle for this scenario, and I am going to inject my insulin. Okay. Discard my needle. Gently apply pressure with alcohol prep to the site. Once that has been done, I'm going to discard my gloves. Gonna wash my hands, and I am going to document into the patient's chart.